These are my audience members. Okay. Ulcerative colitis, its causes, diagnosis, symptoms, and treatment. I have been living with an invisible disease for the last 9 years. According to the Mayo Clinic, ulcerative colitis is an inflammatory bowel disease that causes long-lasting inflammation in the colon and rectum, also known as the large bowel. Ulcerative colitis is considered an autoimmune disorder in which the body attacks the lining of the large intestine. Today I'm going to tell you about ulcerative colitis, its causes, diagnosis, symptoms, and treatment. The exact cause of ulcerative colitis is unknown. It was previously thought that diet and stress were a cause, and while this definitely makes this disease worse, it does not cause it. A malfunction in the immune system is one suspected cause of UC. Instead of fighting off an infection, this malfunction can cause your body to attack the colon cells. Ulcerative colitis appears to be more prevalent in people with family members with the disease, and it is also more prevalent in well-developed areas as opposed to underdeveloped areas. It affects people from ages 15 to 30 the most, but it can affect people of all ages. It is more prevalent in Caucasians, but can affect people of any ethnicity. Now that I have discussed the causes with you, I'm going to talk about the signs and symptoms of ulcerative colitis. The biggest symptom of ulcerative colitis is frequent trips to the bathroom. You spend a lot of your time in the bathroom when you have this disease. Along with the frequency, your bowel movements are loose and they contain blood and mucus. It also causes a lot of pain. This pain ranges from slightly crampy to, please God, just let me die. During a flare-up, you can experience fatigue, lethargy, appetite loss, and a decrease in weight as a result. Ulcerative colitis can also cause problems in other areas of your body, such as inflammation of your skin, joints, and eyes, as well as anemia from blood loss. Since we've talked about the symptoms of ulcerative colitis, let's talk about how ulcerative colitis is diagnosed. The number one test for ulcerative colitis is blood tests. Doctors start with blood tests. They check for anemia and signs of infection. Stool samples check for white blood cells in the stool, as well as any infections that could roll UC out. The main test that provides a diagnosis for this disease is a colonoscopy. A colonoscopy is the only definitive way to be diagnosed with ulcerative colitis. It allows your doctor to see your entire colon, as well as take biopsies to definitively diagnose UC. X-rays and CT scans are done as well. X-rays can show if your colon is perforated. CT scans can show how much of your colon is inflamed. After you are diagnosed with this disease, you have several treatment options available to you, such as steroids. Steroids are a short-term medication. They reduce inflammation in the intestines, and they also suppress the overactive immune system response in the colon cells. Anti-inflammatories are a long-term medication that reduce swelling in the intestines. Immunosuppressives are a long or a short-term medication. They are used to suppress the overactive immune system response in colon cells. You are put on these after steroid treatment. A TNF blocker is also an immunosuppressive medication. They differ from other immunosuppressants because they are a biologic and they are taken differently than the others. Your last option available to you for treatment is surgery. There are a couple different surgeries that can be done. One is complete removal of the colon with a colostomy. They can do one where they rest your colon, give you an ileostomy, or J-pouch surgery, which is where they remove part of your colon and create a pouch for your waste that then exits the rectum. Ulcerative colitis is a life-changing diagnosis. It is an incredibly difficult disease to live with, and people without ulcerative colitis do not understand the disease at all. I am always tired. I constantly feel like I'm sick, and I take more medications than most people that I know. But the support that I receive from my family and friends is what has enabled me to make it through the ups and downs that UC has caused me.